Good morning. The day after the elections, we still are not sure who's going to be our president. I understand all that. Let's talk about today's topic is insurance companies. Insurance companies. I love, you know, I have no problem with insurance companies doing business, but I have an issue with insurance companies, folks. No matter which one, no matter what it is, it doesn't. I am not, I'm not paid by the insurance company, but I'm telling you, insurance companies have to wake up, man. What they're doing is a lousy job. They're not helping the Americans. They're not helping the average folks. They're not helping anybody. They're helping themselves. What they're doing is, if you're looking at this daily bombardment with free eye checkups, free dental care, free Medicaid, free drugs, what they're going is they're chasing after the dollar, your dollar, and your dollar government is wasting on them. But has they woken up to serve the consumer, to provide personalized health care? No, they don't want to do that because it's not there in their interest. That's why I would like to, if I'm the insurance company, if I own the business, I would love to start a new business, man. The other day I was Googling for personal health insurance.com. It's taken. Somebody is looking into it. I would love to start a company, personal health insurance. And then I took over a domain called Health Insurance Personalized. I own it. This is what it is. Insurance companies are already seeing the health solutions advantage accounts being HSA accounts. There's so much money in the HSAs. United Healthcare, my health savings is with the United Health. Optum Bank is owned by an insurance company. Hey, that's a good thing for United Healthcare owning a bank. I'm pretty sure all these insurance companies own health savings accounts. What I'm suggesting is these insurance companies should be serving the people, man. They're not. They're self-centered. They're profit-driven from Wall Street. If they are listening, they need to wake up. They need to wake up. The Americans are going to force you to start this health disclosure, healthy pricing accounts. They're going to come in, all 160 million blue-collar workers, even 60 to 70 government subsidized. Actually, another 10, 20 government subsidized, including veterans and all. They're coming after insurance companies, folks. We need to have some changes. But they can change themselves in the favor. They don't need any rules and regulation. They can change themselves to accommodate the public interest, public demand. They don't need any legislation. They can modify it. What I would like to see is insurance companies embrace, all of them, embrace health disclosure, healthy pricing. So you have a deductible portion. Initially it may be employer subsidized, initially it may be government subsidized, and they should offer everyone that. Then that way they can every consumer can put aside however saving every month, put aside 300, 400, whatever. Individually you can put aside 300. Family, you can put out $750 every month. You're spending thousands of dollars on insurance anyway. Lower your premium, put money aside, and that will give you the power, what the consumers want. I want the power back to the consumers. Americans need to wake up that day. They need to control. They should be able to choose their insurance. They should be able to choose their doctor. They should be able to choose their facility. They should be able to choose. Healthcare costs will come down, folks. Ultimately, there have to be deregulation in healthcare industry, dramatic deregulation, like what we did to the airlines. The health regulations, so the way they are, it's not sustainable. Certificate of need. What is certificate of need? If you want to open a grocery store, you need a certificate of need. Come on, healthcare is no different from food industry. Why can't they equate with the food industry? We have so much of competition, and we are doing a damn good job in the food industry. Look at Amazon. They get into the groceries. Everybody wanted a grocery. And next thing, I would like Amazon gets into healthcare. Everybody, Google, Amazon, Microsoft, everybody should get into it. And they should offer this. All these large employer groups should offer health disclosure, healthy pricing. I think Silicon Valley already has embraced the health savings, health solutions advantage, folks. There are some of the areas are already embraced the health solution. But what I would like to see it happen across the board. I want the insurance company should be serving. They're not supposed to be advertising. Consumers should be looking. Their price. They should be transparent. They should be advertising how much is the premium. You don't see that, do you? Do you see the drug companies putting the prices? You don't see that, do you? Even the hospitals, they are mandated next year. I want to see the insurance companies putting the premium. How much is the premium? For HDHP, not for traditional. I'm talking about HDHP. They need to be competing for every dollar. And the consumers will crawl and they said, oh, here I save big times. I will take this insurance company. I'll grab this insurance company. This is the way it should be, folks. This is not a radical approach. This is a consumer demand. Come on, this is what the consumers want. They want consumers to be in the driver's seat. Everybody wants consumers to be drivers. I would love to see that tomorrow, instead of seeing this Medicare Advantage, all these ads, oh, we'll give you all this free. That's not free. Come on, give me the price. How much is your premium? So I can put money aside into my health solutions advantage, HSA. I can put, that is my money to keep. You can grab the money from the CMS, Center for Medicare. You cannot grab the money from the, HHS, Health and Human Services. You cannot grab the money from the federal or state government. That is ours to keep. Federal government has to give us choices. Which one to choose from, where I can save money. Give me that power. That's what I want. Americans want to save in healthcare. They don't want surprise medical bills. They don't want billings. They want to pay as you go. And ultimately, these facilities, you name it, providers will follow through, man. They will be advertising. You're already seeing telehealth, telemedicine, and hubs popping up, giving prices for this visit, that visit, telehealth. We want more competition, not consolidation. This is what is happening. People who have this so-called full risk contracts, including all these insurance companies, Blue Cross, Blue Shield, you name it, Humana, everybody. I don't want to be specific about any insurance. Even United, AARP, if you're listening, demand for the freedom. We need to choose which plan it is cheaper. That's what it is. We want a cheaper and more efficient plan we can choose, so I can put money aside into my savings. This is what I want. This is my goal. Ultimate goal is I want to accumulate wealth, freedom, and so I can retire early. I'm already retired, so I'm talking about the average folks. People in their 30s, they have a bright future ahead. I can foresee what these insurance companies in another not too long future will be advertising for with a premium transparency. How much is the premium? I want to know what the premiums are. This is my goal. I want to see tomorrow, hey, our premiums are only $300. If you're 40, it's only $300 for HDHP accounts. Health disclosure, healthy pricing. And ACA is one of the best things we have gotten. Affordable Care Act, one of the best things they have ever done is this is what changed the entire concept, is guaranteed health coverage. ACA has introduced that. Number one, guaranteed health coverage. Number two, pre-existing illnesses. Number three is transition from parental to individual coverage 26. And number four, catastrophic coverage, and number five is major medical. We need to have all the elements incorporated in the health disclosure, healthy pricing accounts. We want all the elements incorporated. So display, I want to see the ads from the insurance companies instead of, you want to make money? Come on, you can make money from the consumers, not through the CMS and HHS from the federal government. Make money off of us. Then that's called free market. This is not a free market. There's no competition. If you like this channel, join this channel, subscribe, hit the notification, make some comments. I'll be keep bombarding with this same slogan, freedom in healthcare. We'll see you in the next episode. CCN Network.